Hello, I'm Dr. Arti Kandolkar. I'm a consultant psychologist and a counselor. Today, we are here to discuss on another important topic called depressive disorders. Okay, these disorders come basically under mood and related disorders. In previous lecture, we have discussed about bipolar and related disorders, which covers all bipolar 1, bipolar 2, and cyclothymia. Now, the second part, actually this is the second chapter in DSM-5, says depressive disorder. Here there are two types of disorders, okay, major depressive disorder, and there is dysthymia, okay, or persistent depressive disorder. So we are going to discuss this both. So let's begin with understanding what is depressive disorder. Okay, what do you understand by when we say depressive or depression? So depression is something just like anxiety is very much treatable. Okay, those who seek immediate attention, okay, or when they identify some symptoms like they are sad, not getting interest in regular things which earlier they used to get, okay, if they seek treatment, then there are chances that 80 to 90% of the people can get treated, okay, and it can be well managed, and many people get relief from psychotherapies or counseling. Okay, so we'll be understanding what is depression, okay, what are the symptoms, diagnostic criteria. So let's begin. Okay, introduction to depressive disorders. Okay, depression is also known as major depressive disorder, okay, is a common and serious medical illness that negatively affects how we feel and how we think and act. So it is like its impact on our overall, like our thinking, behavior and feelings. Okay. Next, depression causes feeling of sadness or loss of interest in activities once enjoyed. So as I said, people who experience bouts of depression, okay, generally they lose interest in things they used to enjoy earlier. Okay, so it is like loss of all the activity they would have enjoyed. Okay, and there is a little feelings of sadness. I won't be able to do it, it's difficult, it's not my cup of tea, or all this kind of what you can say feelings. Okay, it can lead to variety of emotional and physical problems, okay, and decrease a person's ability to function at work and at home. So it is such a disorder or such a you can say mental illness which affects your overall functioning everywhere you go. Okay, even if it is home, your workplace, where you go for some party, some interviews, everywhere it is going to show up its presence. Okay, fortunately the depression is treatable. Okay, so that is very much treatable just like anxiety, but you have to take an early action. First of all, understand what is depression, what are the symptoms of depression, and yes, definitely you have to visit a psychologist to understand that better technically. Next, I hope this is clear. What is depression? I try to explain this as a definition. Depression is extreme sadness, okay, that or despair that lasts more than days. So this is like something which doesn't come and go. Like suppose because of some work I'm not feeling early morning happiness, so by evening, okay, by afternoon maybe I may feel happy. That is not depression. Depression is something that lasts for longer, more than a day, more than a week, more than months sometimes. Okay, it interferes with the activities of daily life, your overall life, and can cause physical symptoms such as pain, okay, loss or gain of your weight. Then sleeping pattern will be disturbed. Okay, you may be sleeping too much or too little, or lack of energy throughout. Okay, no matter what you do, how much motivational videos you see or something, you may not feel that energy all the time. Okay, next, types of depressive disorder. Now moving to the types of depressive disorder, we'll have to understand what are the types that comes. The first is major depressive disorder. Okay, this is the first one, which is also you can say unipolar depression. Unipolar. Unipolar depression. So that is the first one. And second is persistent depressive disorder, or it is also known as dysthymia. We are going to understand this in detail. Okay. So next we are going to discuss on types of depressive disorders. Okay. So basically there are two types: major depressive disorder and persistent depressive disorder. Okay. Now major depressive disorder is also known as unipolar depression. So it is on one pole only, not the pole on the mania side. Okay, so depression is unipolar. Major depressive disorder you can call, or you can also call major depressive episode. Okay, all means the same. And the second is persistent depressive disorder. This is more chronic, not so severe. Okay, but it is like lasting for longer. So this major depressive, you can say it lasts for around 2 weeks, and this one, okay, will last for around 2 years. Means, I mean, if you want to diagnose a person with major depressive, persistent depressive disorder, you need to understand, you have to diagnose or see the person for around 2 years to meet the criteria. Okay, while major depression 2 weeks or more is necessary. So these are two types. Let's go to the next slide. We'll see some symptoms of depression. Okay, when we use the term clinical depression, it referring to the major depressive episode or major depressive disorder. So there is one more term that we have found is clinical depression. Okay, it's also known as clinical depression. Major depressive disorder is a mood disorder that characterized by a number of key factors to note down. Okay, depressed mood, sad mood, basically lack of interest in activities normally enjoyed. The once you in a normal state of mind, whatever you enjoy, like you may enjoy good food, you may enjoy watching movies, okay, you may enjoy going out. Okay, so all these activities seems boring and useless. Okay, changes in weight, like weight gain or weight loss, changes in sleep patterns, sleeping too much or too little, fatigue, not interested all the time, lack of energy, feeling of worthlessness and guilt. So you feel yourself useless, helpless. I cannot do. I am not so. You can say I'm not so good to for anything. Okay, and feeling of if you make minor mistake, you will be doing overthinking over it, and feeling that of guilt will be persistent. Difficulty concentration on task, and thoughts of death and suicidals are also prominent. Okay, the person who suffers from depression eventually may become suicidal. So these are key factors. We are also going to see diagnostic criteria. Okay, these are just the symptoms to understand. Next is major depressive disorder. Okay, let's go. We have understood the symptoms.